HIV self-testing kits are now available at a more affordable rate at several pharmacies across the country. The Independent Community Pharmacy Association says the kits previously cost over 200 Rand, but now come in at under 50 Rand. This comes after the High Court in Pretoria gave the green light to the pharmacist-initiated management of antiretroviral therapy last month. It allows pharmacists to prescribe medication directly to HIV patients. So what does this mean for South Africa's fight against HIV and AIDS? Let's unpack it further. We're joined this morning by the Co-Chairperson of the SA National AIDS Council, Steve Letsike. It's great to see you. Always a pleasure talking to you. One imagines one of the big pros insofar as this development is concerned, Steve, is easier accessibility for more routine testing.
No, indeed. The issue around ensuring that we ensure prevention, we ensure that people know their HIV status is a fundamental important for the South African National AIDS Council. You would understand that we have 8.1 million people living with HIV in the country, and we have been battling with ensuring that people know their status, people, when they are tested positive, they have access to treatment. And our country has been playing this biggest role globally in leading the biggest HIV treatment in the world. We have over 5 million people living with HIV who are accessing free treatment for that matter. So making sure that we have testing kits, it gives options. The most important thing is that we have programs that are led by government, civil society, and private sector that have opened up the opportunity of ensuring that we serve people to understand their status, but also to suppress their viral load for those who are positive. So the access is important, and availability, and also affordability.
Yeah, absolutely. But that's not where it ends, right, Steve? I mean, it has to be part of a wider plan insofar as our strategy for HIV is concerned. It's not just about being able to test at home. There are next steps depending on the outcome.
Absolutely. Remember that the Deputy President launched the National Strategic Plan 2023 to 2028, which have got 4 goals that speaks about prevention, treatment, care and support, and also other options there. So when you have available testing kit, because remember, the services have always been available, and most cases services are free in the country. So the option of self-testing kit, other NGOs are giving the self-testing kits for free, but for those who can afford it and want to buy it in their nearest accessible pharmacies and so forth, they can do so. So what are the steps? Really, the steps really takes beyond you testing and knowing your status. You also can access counseling, through online, through visiting a facility. You also can be, reached out, because remember, when you buy, you can also connect with the service provider who can also guide you to say, when you test positive, what do you need to do? Because we also need your confirmatory testing that can actually ensure that your results are really indeed positive and you can be initiated immediately. Our program, even in the country, when you are testing positive, you get to be initiated immediately so that we can suppress the viral load.
Absolutely. Does it deal with the issue of stigma, do you think, Steve? I mean, are we at a point now where knowing my HIV status also means I can communicate that to my partner? It also means, there are several steps that I can now take because it's such an empowering thing to have access to an HIV kit and to do that test at home. But will it take some time still before we can take a look at whether those are the kinds of impacts we will see given this ruling by the High Court?
Yeah, we have been fortunate with the stats that indicated over 90% of South Africans have tested, for HIV, and we need to continuously do it. So just because you've tested last year does not mean that you can't test again. You have that opportunity to do so. So I think we have been really privileged to reach that 90% target. And now UNAIDS have changed the target to 95% of people living with HIV or people must test. Now, which then means that we should not actually be having issues of stigma. Yes, indeed, the country still struggle with the history of prejudice and the issues of stigma and discrimination. But where we are managing HIV response, we should be able to then say, how do I actually alert my partner? How do I actually make sure that if I test, and my partner have got access to test anytime and anywhere? So we are really improving the efficiency of responding on time, people knowing their health status, but also people getting help on time. And you can get help on time that is really free of stigma and discrimination.
Yeah, but you wouldn't say we're at the stage now where getting an HIV screening is about the same as getting tested for your blood pressure or your blood sugar or your cholesterol. We're still some way away from completely removing the stigma.
Well, I think, there's a lot. Stigma index was released by Human Science Research Council together with SANEC. That actually still indicated that over 40% still struggle from self-stigma. You must understand this is self-inflicted. Now, where you are supposed to then looking at the comprehensive services, many services that we are looking into are comprehensive. When you screen for or you test for HIV, you screen for TB, you screen for all others, STI, including testing your glucose and so forth. Comprehensive services have always been provided. And even with the introduction of NHI, you will see the package is still the same to ensure that we address that. So the self-stigma is what we're battling with more than dealing with the stigma generally in the public. We know that we are not there as a country because we need to change our attitude, our behavior in how we respond to our own issues, health issues for that matter. We see this amongst men. We see this against a key population, whether you're talking about men who have sex with men, transgender, sex workers, and so forth, where people are still struggling with that. And the multitude or altitude of twin stigma around people with disability and so forth. So all these challenges we have to deal with, but we have a response that has been unique in really addressing stigma. The health providers have been very instrumental, and also some of the facilities and, of course, the NGOs providing that. We need to fight stigma at community level, but also at our household level.
Yeah, that's very interesting indeed, Steve, that actually self-stigma is what we are struggling with the most. It's related to my next question. I'm just getting a message from one of my colleagues, and I'm going to put the question to you now. The issue around self-stigma, when we think about mental health issues being on the rise in South Africa, mental health challenges being on the rise, a very important part of HIV testing was the pre-counseling that we received before actually taking that test, because there are a number of ways that people can react to getting a positive result. So what happens now, because there is now essentially no official pre-testing because of these kits?
Well, you would realize that, when we did the pilot projects across the country, where NGOs, were supported to provide, testing, self-testing kits, before handing those self-testing kits, they will actually empower the client. And it's quite important to do so. But even the self-testing kit itself does provide guidance in terms of before you test, reach out, you have that ability to actually own your own action. The fact that you decide to say, I want to implement self-testing, there's a guideline that provides information on how you need to reach out for counseling and so forth. So that should your test result come out negative or positive, you would know what you need to be doing. Indeed, mental health, it's a very big problem in our country, and beyond just the issues of health. Looking at what leads into mental health issues, challenges. October is always dedicated to mental health month and how we can really address this. We need to reduce issues of suicide, issues of, substance use and abuse, things that may lead us to really take very drastic measures into our own life. But remember, HIV is not a death sentence. We have been really doing very well across the world around how we manage HIV. Once you are HIV positive, you can still lead a much long life when you take your treatment, when you take care of yourself, and when you know your status. So we really know that when you manage HIV, even the treatment itself, we implement what we call a chronic management. Same way we manage sugar, same way we manage many also non-communicable diseases. It's a chronic managed disease now. So which then means we've gotten simpler way of dealing with HIV and really treating HIV. People can lead a much longer life, and we've got evidence, we've got people living with HIV that really does live much longer life.
Yeah, absolutely. Steve, Letsike, let me thank you for your time this morning. Such an incredibly important discussion. SANEC's co-chairperson, as we continue to track the story around self-testing kits now available at some pharmacies, several pharmacies, in fact, around the country for under 50 Rand. There's plenty more still.